you watch a movie, read a book, or hear a story about a baby being born, who does the friend, author, or directly mainly center it around? It is usually going to be about four people: the mom, the dad, the doctor, and of course the baby. We sometimes often give all the doctor the credibility when a baby's born and forget about the little helpers that oversee the mom and the baby to make sure that they are functioning properly so that the doctor can actually do his job. These little helpers are known as labor and delivery nurses or perinatal nurses. Hi, my name is Daley Johnson, and I wanted to share with y'all the day-to-day task of a labor and delivery nurse. I chose this topic because I wanted to inform you all about how much care and dedication that these nurses put into their job. While writing this speech, I used three sources. One from an internet source was www.jhresources.com, a book titled Career Discovery Encyclopedia, and an article that I got off EBSCOhost. Throughout my speech, I will inform you about what labor and delivery nurses do before the baby's born, during and after the birth, and also other additional tasks that they perform throughout the day. The first point that I want to share with you all is what they do before the baby is born. These nurses must have good communication and phlebotomy skills and also a lot of patience. They deal with cranky, hormonal women for long hours of the day, so you can only imagine how much patience they have to have. They have to be able to read contractions and know the time between each of them. And as I said before, they have to know how to perform a phlebotomy. A phlebotomy is when they basically take someone's blood or inject something into their body. They must also have to know a lot about hemodynamics, which is the study of blood. In addition to knowing that, they must know how to give an epidural. An epidural is a shot that the nurses give the woman in her back that will paralyze them from the waist down so that it is easier for them during the birthing process. Furthermore, they must know how to do vital signs, give pain medications, and be able to read a fetal monitor, which monitors the baby's heart rate. Also, they must know how much a woman has dilated so that they will know if she is ready to go into labor or not. Additionally, they must be able to clean up body fluids so that the mom can have a nice, clean place to deliver the baby in. The second point I want to discuss with you is what the nurses do during the birth and after the birth. They must know how to put the mom in the correct position and make sure she is comfortable throughout this process. In addition to doing that, they must also be able to assist the doctor with putting on gloves or gown and be able to give him tools that he will use during the birthing process. In addition to all that, they must know when to tell the mom to push at correct times. Furthermore, they must record the time that the baby is born and be able to clean and care for the baby afterwards. Additionally, they must also be able to work in other positions depending on the setting of the delivery. My third point I want to discuss with you all is the additional tasks that these nurses perform throughout the day. These nurses must be very dependable. There is no telling when a mom will have this baby, so they must be ready day or night to go in. They also must be respectful of the OSHA requirements. OSHA is a abbreviation for the word Occupational Safety and Health Administration. This allows the safety of workers on the job so that they don't get hurt as bad. They must also be respectful of their patients' religious and whatever beliefs they may have. They must also be respectful of the HIPAA law. HIPAA stands for Health Insurance Portability and Accountability Act. This ensures that the patient's personal information is safe. The nurses and other staff that have the availability to their information must keep it safe so that they don't go around spreading whatever diagnosis these people have been given. They must also be able to move patients, such as from bed to bed. In conclusion, I would like to remind you all about how much dedication that these nurses put into their jobs. It's not an easy task. This job requires a lot of dedication, and it's not easy. But being able to watch the miracle of a baby being born and a family come complete is an award that not anyone would not want to miss.